So let's delve a little bit deeper. Let's be more concrete because not everyone will get a chance to see you. And the goal I have to interview you is, so for a patient with different stages, especially late stage of melanoma, they come to see a surgeon, they can at least expect some of the dialogue, some of the conversation you have, right? So they won't be surprised when they meet their doctor. Let's take by case basis. Let's say someone who has stage 1 disease, right? We know it's relatively straightforward. And they walk into your office and you tell them you have stage 1 disease. Now, what's next? What do you tell them?
But this is a very frequent visit. Many patients present to us with early stage disease. And I think the most important thing is to alleviate some of the fears that have been generated once they are told they have melanoma. Because many people feel that once they have a diagnosis of cancer, the cancer is a death sentence. And it's not necessarily true. With early stage melanoma, the survival is outstanding. Greater than 90% of patients will survive long term. And that's the first thing that I tell them, that if they are presenting with in situ disease or early stage disease, stage 1, then I let them know that they're going to do very well. The most important thing is that we have to accurately stage their disease, and stage is really just a surrogate for tumor biology. How aggressive has the disease become? And then we go into the treatment. Most of the time for stage 1 disease, it's fairly simple. It requires a wide local excision, which means that I'm going to cut out the cancer on their skin and close their skin back up appropriately. And then we have to discuss whether further staging workup is necessary. For the most part, for early stage disease, that's all they need. The other thing that I impress upon them is the treatment that comes afterwards, which I think is much more important, because I let them know that their melanoma, if it's at early stage, will never hurt them. However, because the process that causes melanoma is solar radiation, the rest of their skin could be affected, and that means that surveillance is very important. And then finally, of course, protecting the patient from developing melanoma in the future, which means sunscreen use and also protection from extensive solar damage, and then, of course, never utilizing a tanning bed.
No, that's all very valid. And I think, you and I sort of do the same type of work for up to stage, I think, 1, because once over stage 1, and then we get into the idea of sentinel lymph node biopsy, that I have to defer to your expertise a lot of times.